I'm Dr. Rachel Tate for RoomNow.com, enjoying virtual ACR Convergence 2021. I personally have a special interest in pregnancy and PsA and SpA patients, and I wanted to highlight 3 abstracts from 2021's ACR discussing risks, disease activity, and outcomes with you today. So in abstract number 039, Dr. Maguire et al. In Ireland collected data from the Ankylosing Spondylitis Registry of Ireland, ASRI, looking at overall complication risk in SpA pregnancies. A total of 220 female SpA registry patients, 61 reported a total of 210 pregnancies that resulted in 166 live births. 58% of these pregnancies were uncomplicated. Miscarriage frequency was found to be about 20%, and 37% of patients experienced miscarriages in total. The most common complication that was reported was C-section. That was only 10% of patients. 11% experienced preterm delivery, and the most common fetal complication was NICU admission in 11% of deliveries. This is also kind of interesting too. Only 5% of women reported difficulties conceiving, and none of them needed to go to reproductive endocrinology or seek additional help in order to become pregnant. Breastfeeding was also found to be low at only 33% of live births. Abstract 1722 out of Sweden and Denmark looked at the registries to determine preeclampsia risk in rheumatoid arthritis, psoriatic arthritis, and AS patients. So they identified a total of 1,700 RA patients, 800 SpA patients, and 489 PsA pregnancies. Their analysis showed that pregnant psoriatic arthritis patients were more likely to be obese, they were more likely to be smokers, and weirdly, they were more likely to be less educated. Further, this population was the only group found to be at increased risk for preeclampsia. And monotherapy treatment was also considered an increased risk of preeclampsia in this particular population. So this makes me question, is there a disease activity component within this potential role? In terms of pregnancies, the risk of preeclampsia doubled with high disease activity compared to controlled pregnancies. Now that's something we've seen before in other studies, but this was not observed in SpA or psoriatic arthritis patient populations. And last but not least, abstract number 1730 out of Germany and the REKISS registry. So as you may be aware, the REKISS is a prospective longitudinal cohort study. And in this particular study, the group looked at disease activity and pregnancy outcomes in SpA. So there were 140 SpA pregnancies that were included. 74 had not been exposed to DMARDs at conception. 38 of these patients were exposed to biologics at conception, were not exposed to biologics during pregnancy, and 28 were exposed continuously from and all the way through pregnancy. As you can imagine, the biologics prescribed were certolizumab at 50%, adalimumab at 21%, except 12%, infliximab 9%, golimumab in 2 patients, secukinumab and ustekinumab in 1 patient each. That's a mouthful. The group found that the frequency of flares increased in the group that was exposed to biologics initially, but were stopped on therapy during pregnancy. And those flares tended to worsen as the trimesters progressed for each. Flare rates were the lowest, as you can imagine, in those patients who were continuously on biologics. In terms of the outcomes, 95% of patients, and in this particular case, the pregnancies resulted in live births. Each group did have 2 spontaneous abortions. 1 pregnancy was terminated due to suspected malformations, and 1 triplet pregnancy resulted in 1 live birth. So the overarching themes for me remain pretty much the same as they have been. We need to treat our patients appropriately, regardless of their potential for pregnancy, and to educate them on their disease. We need to be aware that worsening disease can lead to worsening pregnancy outcomes for patients. And we definitely need to have that risk-benefit discussion with patients overall for all of our disease states and for all of our drugs. The better we educate ourselves, the better we will be for our patients. For more ACR Convergence 21 coverage, Follow us on roomnow.com. And of course, follow me on Twitter @UpToTate.